In clinical practice, we see the majority of people who walk into our clinic with skin cancer are old men. So we questioned whether this was because they were more sun exposed over a lifetime due to outdoor work, etc., or because they're bald and have more damage to their skin over a lifetime, or if there was something fundamentally different about the two sexes. It is very difficult to test this in humans because they have different backgrounds of damage and different susceptibility. And for that reason, we used animals.
So it was quite surprising and interesting for us to find that even though the females were developing less tumours than the male, when we looked at the response to the damage in the tumours and mutation burden, we actually found that there was no difference between the male and female tumours. So then we decided to look at how the normal skin is responding to the treatment that induces cancer. And that's where we actually found that the female mice were having such a stronger immune response to the causes of cancer than the male mice. So this was occurring even before the tumour formation happened.
To validate this in humans, we used several human cohorts, one from Salford Royal Dermatology, in addition to the Christie Hospital and St. George's Hospital for the UK. And we validated this internationally in a southern French cohort from Marseille. We were able to show that immunocompetent women strongly resisted the more severe forms of disease, and they lost that protection when their immune system was damaged. This paper will be helpful to clinicians because it indicates that men and women need to be stratified differently. First of all, prevention needs to be strengthened in the male population as they are more susceptible to get the disease, and they need to be monitored closely because they are more likely to progress and have more severe forms of disease. It is important also to think that when you have an immunosuppressed patient, sex no longer matters and both patients will be very susceptible.